Welcome to Medcast. Here, we delve into the latest breakthroughs in medicine, equipping you with knowledge that can enhance your health and well-being in day-to-day life. In today's episode, science meets soul and precision meets purpose. My guest isn't just a surgeon. He's an artist, a visionary, a truth teller in a world obsessed with image. With hands that heal and a voice that challenges, he is not only reshaping faces, he is redefining beauty and the future of plastic surgery. Let's dive into a conversation that goes far beyond skin deep. Allow me to welcome Dr. John Shamoun. Dr. John Shamoun is a world-renowned expert in plastic and reconstructive surgery. Dr. John Shamoun, welcome to Medcast.
Thank you. Glad to be here.
It's truly a big honor for us to have you today and to speak about all the interesting topics that we need to know your opinion about.
Sure. Happy to voice my opinion.
Yes. So I will start by asking you, what inspired you to pursue plastic surgery?
Well, that's a difficult question, but I'll try to answer it. Ever since I was a little kid, I was always intrigued by the human body and how it works. And along with creativity, being creative, and it landed me in a situation where the only thing that I could do is something related to biology and physiology. And I liked the way the pathophysiology of the human body works. And so I was able to gravitate into a field that allowed me to be creative and yet use the art and science of physiology and anatomy to become a plastic surgeon. So it was, initially I wanted to be a heart surgeon because I liked the heart. I finished general surgery completely and was going into heart surgery. But in heart surgery, we do 10 or 15 different operations, which is unlike plastic surgery because you're doing the same operations in general surgery and heart surgery, but just in different bodies. Whereas in plastic surgery, every operation is different because you're seeing the actual result in the mirror. And the pieces of the puzzle have to come together, and you would never want to do something that's a cookie cutter procedure. The same is never done for each individual patient. If it's done well, it's going to be different, and it's going to fit the surrounding parts. We can talk about the face, the breast. Yes. Everybody's body is different. Sure. There's 7 billion people in the world, all unique, all with different fingerprints, and that in itself is amazing. So yes. I wanted to be creative and wanted to be able to use my skills and use my artistic ability, and that was the field that I gravitated to.
Yeah, that's brilliant. And throughout the years, do you feel like now, is it only a profession or it is a calling?
Well, I think it's both. For me, it's a calling because I enjoy it and I have a passion for it. Unfortunately, with social media and marketing, we're seeing a lot of hype, and we're seeing a lot of gimmicks, and we're seeing a lot of bad surgery, and we're seeing things that are not in the best interest of the patients, all in the name of greed. Unfortunately, that's life and that's nature. When you mix ego and power and money, it's easy to see where that takes you. Yeah. And unfortunately, a lot of the patients we see in cosmetic plastic surgery are a little insecure for some various and a sundry reason. And some physicians play upon that insecurity of patients in a bad way, right, to make money.
Yes.
And it takes someone who really has the knowledge and skill and experience and know-how and proper ethics to say, no, that's not the right thing to do. Right. It may be the right thing to do short term, but you're really hurting yourself in the long run. And so many physicians refuse to do that, nor do they know. So the knowledge is everything.
Yes.
And in this profession, you know, there's prudence, is doing quality surgery as a prudent physician. But today you need wisdom.
Right.
And the wisdom is looking at the long-term ramifications of what we're doing. And that's what's important.
Right.
Because the biggest fallacy of plastic surgery, at least in this region, and even in America,
Yeah.
is that patients actually believe they can keep doing it. They can do it over if they don't like it. Well, I hate to break it to people, but you can't just keep operating on the same body part
Of course.
and expect it to behave in a way that you did it the first time.
Very true.
And so it's not like, okay, I don't like that wallpaper, or I don't like the color of this wall. Well, you can go to the local store and get a new wallpaper.
It's
That
a human
does-
body
that-
and
you,
human
you
face.
can't go
and-
get a new nose.
Of course.
We have to work as plastic surgeons with what is given to us, and hopefully it's not altered to the point of no return.
Of course. Of course. I'm coming to ask you about these, the marketing and the hype later in this podcast. But I want to ask you, because you have worked all over the world, how did this define the perception of beauty and the perception of patient care? Because you worked, we know, maybe in all the continents. So
Sure.
let me know, how did this redefine the perception of beauty?
You know, I think that's a very good question. I think there's beautiful people all over the world. There's, you know, the cultural variations in the GCC are different than America. I mean, the women here are known for almond-shaped eyes, beautiful brows, thick, long hair, honey-colored skin. I mean, those things are beautiful. And yet now you're seeing them try to change that into an American sort of Western trend, which is not so good, because that's what makes them beautiful. America, now the trend is a snatched jawline, those kind of things. Less is more refinement is happening now as opposed to the past. But the cultural variations are very important, because in this part of the country or the world, I can't make a Western nose for an Arab girl.
Right.
I mean, that's
Doesn't
first
fit.
of all, they're not going to like it. Second of all, doesn't fit their culture. And thirdly, as time passes, it will age differently. So we have to respect the cultural variations. And then there's some stigma. There's, in the Asian cultures, or in the Buddhist culture, a large, long earlobe is a sign of wisdom. Where in America, we reduce earlobes.
Wow.
In the Asian culture, the larger the nostrils, the more your money's going to go away. So there's these stigma.
Yeah.
So
you
you
learn
have-
a lot about cultures
Well,
from your work.
and not only that, but for example, in my office, I have a lot of celebrities that come in. I have a lot of different cultures that, luckily for me, I have an international practice. But a Japanese lady that comes in and an Arab lady that comes in, they're two different people. One is looking at you directly in the eye. That's the Arab girl. They like communication. Lebanese, they like hugging, kissing,
Yes.
being cordial.
Yeah.
The Japanese culture is a little more refined. So you have to speak to them a little differently. But these cultural variations are beautiful, because that's what you need to respect. And you need to find out, as a plastic surgeon, what are the motivations? Why are they wanting to do what they want to do? And usually there's some underlying issues that are related to why they're insecure or what they want to change. So
How do you speak to them? How do you convince them to choose healthier, long-term outcomes rather than the quick fix trends?
that is the $1 million question. And it's a good question. Today, it's harder than it's ever been. lots of insecurity, lots of free time, lots of boredom, lots of going on their phone and trying to...
And the selfies.
The selfies. So I try as a plastic surgeon, I mean, I'm very busy. I'm not a marketer. If you go to my Instagram site, you'll see it's all about education. It's not about me. It's not about my personal life. It's not about selfies in the operating room and I'm showing all these surgeries that are 1 hour into the surgery. It's about educating people on what looks good, what doesn't look good, what withstands the test of time, and what is just dangerous. And I think people respect that. So the answer to your question is it's, I hate to say this, but cosmetic surgery, for example, it's a $2.5 billion industry in the GCC today.
Wow.
It's projected to be an $8 billion industry by 2035. So it just shows you the money that's gravitated into this field.
Right. Dr. John Shamoun, will you stop a patient from doing a procedure?
I probably...
If you find, of course...
I probably estimate that I talk 10 people out of surgery a week. Or I try to. Now, that doesn't mean they're going to listen, because many of those patients say, well, Dr. Shamoun won't do my surgery. He's wrong. I'm going to go find somebody to do it. And you will always be able to find someone to do the surgery that you're wishing, because of the lack of training, the lack of education, the lack of ethical, having a conscience,
Standards.
and the knowledge. Some of these physicians just don't know what's going to happen in the future, and they're undertrained. They have very little experience. And I tell people this all the time. You go see a surgeon, a plastic surgeon. Would you rather have someone who's been out of practice, been into practice for 5 years, well-trained, or would you rather have someone who's been in practice for 30 years? Doing the same thing? So one of them is a young person who is up to date on the state-of-the-art procedures and is knowledgeable, versus a fella who's been doing this for 30 years and experienced. So I tell people this, and I really believe this. Knowledge does not trump experience, but neither does experience trump the knowledge.
Right.
The best case scenario is get someone who's very experienced and who has kept up with the literature and knows the state of the art.
Right.
Because he can balance what works with what is hype based on his experience.
Of course.
So, there's a lot of young surgeons out there that have very little experience. They do good work. They're very knowledgeable. They're well-trained. They just don't have the experience.
In my opinion, experience is very, very, very important, especially in plastic surgery. You need it in all the fields of medicine. As a doctor myself, I know how experience reshaped my practice, although I'm not a surgeon. However, when it comes to surgeons, skills walk hand in hand with knowledge. So you need the skills and you need the knowledge, and they are together. Of course, the skills come from the years of experience.
Well, you're 100% correct. I actually believe that it's kind of interesting when you look at skill set, but this is life. This is not just for professions like doctors and surgeons. I classify people into 5 categories: bad, average, good, excellent, and elite.
All right.
In any profession.
Okay.
The majority of those people are average. Okay, they're in the second category. Maybe 20% of people are bad at what they do, no matter what profession. And about maybe 60% are average. Some days they're better than others, some days they're not so good. Then there's probably another 10, 20% that are good. There's probably 5 that are excellent, 5%. And then there's maybe 1 or 2% that are elite. Now the elite, they're humble, they don't really care about advertising, they have a passion for what they do. Their skill set and their passion happen to be congruent.
True.
And they're never happy. In other words, they're never satisfied with the result. It can be the top result you've ever seen, but they're never happy. They're always striving
Seeking
to say,
for more.
I want to make it better.
Yes.
I can make it better.
Yes.
But
These are required because these are the dreamers. These are the shapers of the future. So humanity
true.
will never forget, I think, the elite, the 1% you spoke about in any career. These are the ones to be remembered for years.
Correct.
And they can affect generations to come.
But here's the problem. I tend to think that having done this for over 30 years, it requires 100% more time before the surgery and after the surgery and during the surgery to achieve a 30 to 40% better result. That's an excellent result. That is only noticeable by a very smart person or somebody who's very intelligent or someone who's got the vision. Therefore, there's a place for the masses and there's a place for the people who want, okay, this is what I want.
Right.
Does that make sense?
Yes, it makes sense.
So unfortunately, in plastic surgery, I do believe after years and years of doing this, that it takes a person, a surgeon, and an extra amount of time to get a really, really spectacular result that is visualized for him and the intelligent, successful, sophisticated clientele.
Right. You took me to a place to ask you about the operating room, although I had questions before, but I will keep them for later. So how do you mix the creativity, the skills, the art, the experience, the knowledge, all this together inside the operating room?
Well, it's simple yet complicated. I have been doing this long enough where I welcome the challenges. I like challenges. I like trying to fix things that are difficult at this point in my career. It keeps me going. I think there are certain procedures that are more challenging in the operating room than others. You will find that most of your facial procedures are a little more complicated than the body and breast procedures because those are covered up, whereas everything in the face we're seeing every day. So there's no room for error. And so the answer to your question is it's about right brain, left brain. Your right brain is your creative side. Your left brain is your analytical side. This is why I like Michelangelo and Leonardo da Vinci. One was left-brained, the other was right. Michelangelo was a sculptor. Leonardo was a painter. Leonardo did more than just painting. He looked at numbers and algorithms and measurements. So he was sort of coming at things from an engineering side. Michelangelo picked up the hammer and started chiseling. No plan, nothing. It was in his head. So you have two kinds of surgeons. You have these surgeons that are like taking measurements and spending 30 minutes before they even make the cut. And then you have a surgeon that already knows where he wants to go. They're both good. Yes. One's not better than the other.
Yes.
But one's more right-brained and one's more left-brained. I'm a combination of both, but more right-brained. I'm more like Michelangelo. I kind of know where I want to go. I don't really need the measurements. I look at a face and go, there's the problem.
Right.
Whereas some people kind of like, okay, let me study this face and figure out where the problem is from an engineering standpoint. I sort of disagree with that because there are a lot of patients that come to me, and if you look at their proportions, they don't fit the ideal, but yet they're beautiful. So what's giving them the character and beauty is the slight deviation from the standard. Don't change it.
Yes.
And I hate doing cookie cutter plastic surgery and taking the character away from someone, and they become what I call a blender.
Yeah.
There's 1,000 people, you can't point them out. They all look the same. Well, what is that? That's not good.
Exactly. They should
It's like
keep their
beauty.
uniqueness.
It's like beauty. It's like it's very hard to put your finger on what is beauty.
Yeah, I wanted to ask you, what does beauty mean to you? What's the meaning of beauty?
I don't know what it means.
For Dr. John Shamoun.
I really don't know what it means, but I know it when it walks in the room. So if somebody walks in here, you just sort of get the idea whether they're beautiful or not in their own little way. And then there's little things. The smile. A smile makes everybody beautiful. It's interesting because they did these studies years ago with children that were born, right? I mean, within the first hours of birth, they recognize beauty. It's something about, it's innately a gift that they can recognize a beautiful mother and a not so beautiful mother, or a beautiful person around them. It's interesting. They've done these studies for years, and that their behavior is a little bit different. They'll smile a little bit, open their eyes a little wider, the little things. So I think there's an innate part of that. And I think the important part is the character that comes with it and the personalities. And, we see all these pictures online and all these two-dimensional photos.
Yes,
it's easy to make someone look good.
The filters.
It's easy to make someone look good. I mean, look at these pictures. Now, Kris Jenner had a facelift recently. Everybody's saying, oh, look how great she looks. She looks unbelievable. Her surgeon's the best in the world. Well, no, wait a minute. The surgeon is good. He did a nice job, beautiful job. But there's a lot more to that photo that people don't realize. I'll tell you what it is. She was on the Ozempic. She lost weight. She had a rhinoplasty, which is huge. You change somebody's nose, the whole face changes.
Right.
She had great skin care. She has a beautiful haircut. Okay?
Right.
The photos are curated.
Exactly.
Filtered. They filter. They pick the best ones.
We have AI now.
And she's smiling. So when you put all this together, you just fooled the crowd. You know what I mean?
I know.
Because there's a lot of patients that you say, oh my God, that's such a beautiful lady or a good-looking man. You see them in real life, they're not pretty at all. And the opposite.
Right.
Some people are just not photogenic. Some people are. So
we don't depend on the photo to define a person if he's beautiful or no.
No, it's so sad because we see patients that come in and they bring these, they bring the models' pictures in, and I know what the celebrity
fake
looks.
standards, and sometimes young girls, who are really beautiful, and they are going to transformative surgeries. Here, I tell you, like plastic surgery walks on a line between transformation and obsession. How do you do something to change? How you keep your practice grounded in meaning? How maybe these people need a psychotherapy, psychiatric treatment. So, what are you able to stop? I know in this difficult time, of marketing and social media, are you able to succeed in some cases who really don't need these standards and they are beautiful in their own way?
It's a fine line. They did a study years ago where they looked at plastic surgery, cosmetic surgery patients in general, all comers. And the study supported the fact that 52% of all patients that have cosmetic surgery have some fundamental insecurity, personality disorder, narcissistic, bipolar, body dysmorphia.
Right.
Okay, now these are mental.
Okay.
These are in your head issues.
That's right. True.
So that means only 48% of people are normal that come in.
Yes.
A surgeon only gets to see the patient a couple of times. Try to figure that out. We're really good at it in my office. I get to, my patients are my friends.
Right.
I don't operate on people I can't communicate with. You follow me? And
Yes.
I don't operate on people that don't really want to do something I think is detrimental. I just don't do it.
Right.
I
Great.
mean, I'm one of these guys. Say, I'm not
Yes.
doing that. I don't
Yes.
care. Go somewhere else. You want to do it, fine. I'm telling you why. Here's A, B, C, D, and E, why it's a bad idea.
You are known for your honesty. Anyway, it's
but
a
I
core
can-
value on your
Well,
yes.
I mean, people either like me or they don't. And if you want to judge a plastic surgeon, go sit in his office for 15 minutes and see who's coming in. If you like what you see and they're kind of normal, then you can kind of get a gauge.
Yes.
But I mean, in my practice, we see patients from all over with all different issues. Mostly these days, they're all redos or reconstructive and trying to fix
Right.
unfavorable results.
Unfortunately.
But in answer to your question that you asked me, there's also a study that says this phone, if you look at an image long enough on your phone, even if it's bad, you start liking it after 2 hours. That's the fad with the big lips and the big butts. There's studies that say, look, okay, 2 or 3 hours and looking at that same image, your brain becomes distorted. You start thinking that's normal. That's why this thing is dangerous. Because you ask anybody else and they say, oh, that's terrible. Why would you want to do that? But you've been looking at your phone all day for 3 hours every day for 3 years. Well, your idea of what reality is distorted.
Yeah.
So
the perceptions are changed.
Correct.
Yes.
I mean,
with the
perceptions
trends.
are everything.
Yes.
But look, I actually do believe, this is going to sound crazy. It's amazing how God puts the pieces of the face and body together in harmony. Now, there's congenital deformities, and there's kids that have, developmental deformities. But in general, it's amazing to me how the harmony comes together. You can see a beautiful lady with a not so beautiful nose if you take that nose and put it by itself. But that nose on her face could not be better.
Wow.
You understand?
Yes,
It's like,
yes.
I mean, I've just posted a picture of Angelina Jolie with 7 different noses. Look at it on my Instagram. She's born with the ideal nose for her face. Why? Because that's her nose.
Yes.
And you see some of these people with these really nice statuesque noses, especially in this country, a lot of the men, those noses are nice. They're manly. They're masculine. You change the nose, you change the person. It's the centerpiece of the face. Now in Turkey, there's a lot of plastic surgery going on, and I have a little issue with some of the Turkish surgeons because they're cookie cutter and they're doing these things that are changing people's faces.
Right.
They're losing identity to become a blender. Nose is beautiful, isolated, but it looks strange on that adolescent young girl.
Right.
And as she gets older, it's going to look more strange because everything else is going to age around it. And the nose is going to look like a turned up young girl with a upturned nose, and she's 60 years old. Well, not the best thing in the world.
This is really kind of big awareness to the audience, to those who are listening to this podcast. Really, we should not change what God has created.
I disagree.
Us,
we should change.
Unless, there is some deformity, or there is some something that can be refined to look better, enhanced, but with very trusted, experienced, skillful, wise, knowledgeable hands. Not with everyone. We can do, of course, I'm open-minded, and plastic surgery is there to make people look better, feel better, do better in life. However, we should not follow just trends and anything, as you said, that we see on the phone, the filters, the fake standards. It's about maybe some enhancements, some refined touches that are, of course, more than like accepted, and we want them as females, especially.
The biggest issue is, you mentioned something about refinement and enhancement. There are things today that I no longer do that we did in the past, and we were trained to do. For example,
tell me.
We see a lot of people that come in and they want their brows raised up. A lady, oh, I want my brows up higher. They look better higher. Look, put them way up here. Well, okay, they want that open eye look. Look at your professional models. None of them, or very few of them, have high eyebrows. Why? Because it's an aesthetically pleasing look to have a lower eyebrow. So we're not doing as many brow lifts as we did in the past. Right. This is why the people that fashion brows and the brow people, the ladies that do the brows, they're really good at what they do. Now they're really masters at the shape of the brow. Right. As long as they put it in the right spot and they don't tattoo it very big and too high. Right. But, what I do is I go, look, the first question, did you like the way you looked when you were younger? If, say, I have a 50-year-old lady. Yes, I want to go back there. Well, let me see the picture. What they describe they want to do and what the old picture is saying are two different things. I go, look at your brows. They were never way up there. And I have to show them that, hey, look, no, what you want is wrong. You're following in a trend of what you think is going to look good, but no, it's not pretty. You follow me?
Yeah.
So we're not doing that as much as we did anymore. Now there's this trend in marketing. There's all these names: preventative facelift, vertical restore facelift, deep plane facelift. Oh, like it's something new. We've been doing this for 50 years, but now it's a marketing term. Everybody's saying, oh, I do a deep plane. Well, wait a minute. We've been doing it for 50 years. Now there's modifications of it. There's some people it's good for. There's some people it's not the right operation for. They look strange. So holding back and having the knowledge and experience is where we're going here as to what looks good. And what looks good for one person is not the same for another. I keep telling people this all the time. Your quality of life is different for different people. For example, I have a lady who has breast cancer. The treatment for breast cancer sometimes is to do a mastectomy, where you remove the breast. One lady is okay with it. She's fine removing her breast and not even reconstructing it.
Wow.
Another lady is devastated.
Of course.
Her whole life has changed. And I think that has to do with security, their support system, their marriage, what they value in their life. I mean, I can tell you a story. I had a surgeon, a pathologist, a lady, experienced pathologist with 5 children. She comes in, she says, Dr. Shamoun, I want you to take my breast off. I said, well, why? She says, well, I have a high family history of breast cancer. And we get into it and we start talking and I say, you know what, how high is it? And it was a little higher than average, but nothing significant.
Okay.
And she's a knowledgeable pathologist who I respect. And I said, well, we're going to take your breast off and we're going to reconstruct them. And I'm not really sure why you want to do that. Why don't we just monitor your breast for breast cancer in the future? She says, no, I have 6 children. I don't want to take a chance. I would rather them not be there and you reconstruct them. And I says, well, I can do it and I will do it. So we were talking, and to make a long story short, she made a lot of sense because her breasts were of nothing more than ornamental value to her. And so you ask yourself this question. Every woman will get breast cancer if they live long enough. and every man will get prostate cancer.
Right.
So she said something to me that was kind of intriguing. She says, well, Dr. Shamoun, what if I told you that your prostate was of nothing but ornamental value? Would you remove it? And I started thinking about that. And I says, okay, well, so it has no function. It's just of ornamental value. It's going to develop cancer eventually.
Of course.
Yeah,
Makes
I might
sense.
remove it. So
Of course. So different people, different perspectives.
different people, different
perception,
perspective,
different values.
You know, they have 6 kids.
Yes.
She's
Quality of life.
quality
is
of
also-
life,
right,
and it's interesting.
Exactly. It's
And
very
the very
interesting, really.
very first person that said that was Alex Carroll, 100 years ago. He said the quality of life is different for different people. That's the ultimate answer to all of what we're talking about.
Right, right. Dr. John Shamoun, I will now ask you, what is the most technically demanding procedure in plastic surgery, in your opinion?
Well, you'd have to break that down because you said plastic surgery. Plastic surgery encompasses burn surgery, maxillofacial surgery, craniofacial surgery, cosmetic surgery. There's a lot. Hand surgery. I mean, plastic trauma surgery. So let's just talk cosmetic. Because there's a lot of challenging reconstructive surgeries because no two are alike and they're very difficult in terms of planning and proper execution of those procedures. But in cosmetic surgery, the 3 most demanding and challenging operations are without a doubt rhinoplasties,
Right.
because the nose is 4-dimensional. You have is just as much stuff going on inside as outside. It's functional. You have to breathe. You have to tailor the breathing with the cosmetics. There's a lot of celebrities out there. They come in, they want to look good on photos. They want to look good in their shoots. They want to look good on camera. They don't care whether they can breathe.
Oh my God.
They go, I mean, I can tell you a few celebrities right now that the
Breathing is everything.
nose looks great on photographs. It's destroyed functionally.
Wow.
To me, that's crazy, okay? But that's how they make their living, and that's what's important.
Quality of life, we're
Yeah.
saying.
So for me, you want to balance the functional nature of the nose with the cosmesis, and you want it to fit the face, like we talked about earlier. But the other reason you're working with small millimeter changes. Cartilages are strong for one person, weak in another person. The Asian cartilage is different than an Arab cartilage inside the nose. The bones are longer in certain people, not so long in others. So it's very difficult surgery. This is precisely why 50% of plastic surgeons will not touch a nose, because it's too complicated and they can't control what's going to happen. So therefore they decide not to do it.
But you do it.
Oh, I do it routinely.
Because it's a challenge.
It's a
for you.
challenge, and I
Yes.
do a lot of revisions. Nothing's harder than a revision rhinoplasty.
Of course.
Now, the second operation that's very, very difficult is breast augmentation with a lift at the same time. Postpartum woman had several kids, postmenopause, has a droopy breast that's deflated, nipples too low.
Yeah.
Well, you got to do 2 operations. If you just lift the breast, it looks better, but it has no fullness at the top. So then you need an implant to give you the fullness. So you're balancing, you're making the breast fuller and tightening it at the same time.
Yeah.
That makes sense?
Yes, yes.
So you're doing 2 diametrically opposing procedures that have to be tailored precisely to give you the work that give you the look that you're looking
And the same
for.
operation.
Correct.
Right.
And probably the third most difficult operation is patients that have big-time facial rejuvenation, where you're rejuvenating the entire face en masse. You're redoing and the portion that's the most difficult is the lower eyelid. If you pick one operation in the face that is as difficult as the nose, it's the lower eyelid. And the lower eyelid in the midface is crucial because we see patients that we blink 15,000 times a day. The lower eyelid, when you blink, comes up about 20%. People don't realize it has a function. It's not just the windshield wiper effect of the upper eyelid coming down. The lower lid is coming up. And that's part of your tear function. When you drop the lower lid 1 or 2 millimeters, the eye changes from almond to round.
Right.
You see it on everybody. Say, oh my God, who did that? She looks different.
Yes.
Why did you change the almond eye to a round eye? And raising the cheek with the midface and the lower eye is complicated. So the lower eyelid's the most complicated, along with the rhinoplasty and along with the breast implants and a lift. So those 3 operations, you better be careful who you choose to do your surgery, and you need to get all your choices and your ducks in a row.
It's about the choice, the great, smart choice, wise choice. I will ask you now about a case you've done that has moved you deeply and changed the way you look at your career or at plastic surgery.
Oh, there's several.
Because you do
Several,
more than plastic
there's
surgery, you
several,
do reconstructive
There's several
surgeries.
good and bad. Bad is someone that I've tried to educate in beautiful person, lady, tried to talk her into not doing anything. I realized she had some type of body dysmorphia going on because this woman is strikingly beautiful, but didn't think she was. You know, we only have so much time in a day, and I can refer her to a psychologist in a discreet way that she's not offended. But she goes and gets 3 or 4 different procedures done, comes back to my office, and looks nothing like she did before.
Oh my God.
So that's heartbreaking for me because I have her old pictures because I took them. I tend to look at people as friends and try to tell them what to do and what not to do, and I can't control what they're going to do. It's almost like a kid that's going to do drugs and you can't do anything about it. Now, on the other side of that, I've had patients that have had some reconstructive surgery that was referred to me by other surgeons. And I had a young lady, for example, that was in a car wreck and had 70% of her scalp avulsed. So 70% of the hair and the skin overlying the bone was removed.
Oh.
And she was devastated. There's 2 patients like this. She was devastated. So when I see a challenge like that, I kind of go, okay, well, this is difficult. Where do we start? How do we plan it? Because you can't read about it. There's no textbooks about it. There's textbooks about concepts, but not this individual person. So I called some different doctors who I respected in the field. And one of them, who is an authority, said, just tell her to wear a wig. Can't be fixed. No. Well, when I hear that, I kind of like go,
yes.
Okay.
You like the challenges.
I got to make this better.
Right.
You know what I mean?
Right.
I like the challenge. Let's do it. So I reconstructed this girl's entire scalp with tissue expanders and charged her nothing. I try to give back once or twice a month for someone who I feel can't afford it, really needs it, will benefit from it, and it's my way of giving back to the community and helping people at the same time. So,
and you do a lot of these.
I do a lot of these.
Surgeries,
yeah, I like doing
God
them. I think but they have to fit the criteria of needing it.
Right.
And so that case stuck in my mind. There was another case where a patient was referred to me from Puerto Rico with a electrical burn. His entire face was essentially burned. Yeah. And I had to reconstruct his nose and his cheek, and he was severely depressed. And we were able to accomplish this surgery for him.
Nice.
In
with great results, of course.
Well, excellent result.
I've seen some of them on your Instagram page.
Yeah, so it was. Those things are challenging, and what's interesting is patients have no idea the complexities involved in getting from A to B. Right. If they only knew what it would take to get there, Some of the surgeons don't even know, but they have a little bit better idea. In a patient, like you present a case to a surgeon, say, go, here's what we started with, here's what we ended up with, and they'll go, oh, that's amazing, unbelievable. But you take a layperson that looks at it, and they won't have the same appreciation because they don't understand the complexity. They're picking things apart that are nothing. They don't understand the complexity to get there, whereas the surgeon does, because he knows, okay, how did you make that nostril so nice? It's hard to do. You know what I mean?
Right. Yeah, it takes a lot.
It takes a lot. And you know, there's a lot of dogma in this profession, like any profession. You know, now there's this trend where doctors are using these fishnet sutures, and if you look at these patients after surgery, you go, what are they doing here? It looks like there's a fishnet over the skin.
You know what, people need to know that in medicine in general, there is a lot of giving. It's about giving, you know, from the doctor himself, from his deep human part to this patient. And when it comes to surgery, I think it's even more and more exceeding. It's a lot of giving with of course, with like doctors who are like you know. So they know exactly what they are doing and how to do it, and they put lot of efforts there. And it has to be acknowledged. You know, for us as doctors in general, and
sure. For you know that as well as anybody in what you do.
Yes,
but it's a time commitment.
Yeah,
and it's about, you know, do you cut corners or do you not cut corners? And we all get tired, and so, you know, especially after you've done, you know, 5 or 6 complex surgeries in a week, you're tired, and so. There's been times when I have someone scheduled for a very long surgery, and I know the labor it's going to take, and I've done 4 or 5 surgeries in advance. I'll tell them, I said, look, I'm pretty tired. This is a long, long surgery. Let's delay it a day or two. I need the rest to give you my undivided attention, to give you my best work. We're only human.
Right.
Some surgeons aren't going to do that.
Yeah.
They're going to say, oh, let's just do. I mean, for me, I've gotten to the point where I try not to do over 2 complex surgeries a day. And if it's long, it's only being 1. My undivided attention is to that one person.
Right.
For the entire day.
Okay.
Whereas I can tell you right now, this is my feeling as a surgeon. You don't want a surgery on a Monday. You don't want a surgery on a Friday, at least in America.
Right.
You want a surgery in the middle of the week.
Right.
Okay? Friday, everyone's in a hurry. The staff's leaving at around noon because it's the holiday coming up.
Yes.
So I know this.
Wednesday, Thursday are the perfect days for surgery.
And you don't want to be the last patient on a Wednesday.
Okay.
You don't want to have a complex surgery starting at 3:00 in the afternoon.
No.
On that after 2 other surgeries. Yes. Well, wait a minute. Can I be the first one, please? You understand?
Right.
These are little nuances.
Yes, very important. But
and you want to have, and people make a big deal, general anesthesia versus twilight and IV sedation. There are certain surgeries you are much better having general anesthesia. You don't want to be moving around, feeling anything. But having said that, you want the right anesthesiologist.
Of course.
So for me, I have good staff. I don't cut corners. I have great anesthesiologists. I work up people thoroughly to make sure they're not going to have any issues. And we have to, you know, get the surgery done. It's like I took my car in about 6 months ago to this mechanic, and he asked me what I did, and I says, I'm a surgeon. And he says, so am I. I said, you are? That's nice. He says, yeah, I'm a surgeon for the car. I said, okay. He said, there's no difference between what you do and what I do. I'm a mechanic, and I'm fixing your car.
Yeah.
I said, yeah, there's a big difference. And he says, what do you mean? I said, well, two differences. You have a bad part on that car. You just go to the automotive dealership and get the part.
Right.
I can't get the part. And number 2, you fix that car while it's running. you can't turn it off. You understand?
Yes.
So it sort of registered with him that, hey, look, we have people that are...
differences, of
There is
course.
a big
yes,
difference.
we are touching lives.
Yeah,
It's totally different.
It's all fun.
Yes, Dr. John Shamoun, I will move to you now to the last part of this podcast, the era of longevity medicine, the era of biohacking, and the new advancement in medicine. What are you excited about most in the advancements of medicine when it comes to technology, artificial intelligence, and how these advancements will affect or reshape plastic surgery?
That's a good question. I think some of the recent advances, for me, I'm excited about regenerative medicine. I'm excited about stem cells, although they're unregulated, and every Tom, Dick, and Harry is doing them. And you just don't, the regulation is out of control. It's the biggest problem with plastic surgery is regulation. Who's doing what, what's regulated, what's FDA approved, and what is really working and what's detrimental. It's like drug companies, like vaccines, whatever. There are certain things you find out 5 or 6 years later, that was terrible. We shouldn't have been doing that. You know what I mean?
Yeah.
However, on the contrary of that, we need progress. That's why in Europe and over here sometimes we have better progress than in America, because we don't have the FDA breathing down your throat saying you can't do that. We're not going to allow you to do that. Whereas in these other countries, you can do it. So every now and then you'll see things that are progressive, and because other countries have been able to do it. Do you know what I mean?
Yes, I know.
I think AI is a two-edged sword. I think it's going to, we got to be careful with AI trying to...
Robotics, you don't want to work with robotics soon?
No, I mean, I think they have a robotic hospital in China now, all robots.
Yes.
They can see 200 times the amount of people that we can see in the regular clinic with doctors. But here's what they're missing. They're missing the empathy, the compassion, the communication, the important part of being a human.
Right.
If that makes sense. I'm a little bit concerned about AI will have a difficult time replacing a surgeon, okay? Because of what I mentioned earlier. Your creative surgeons are, it's like the Pieta that was a sculptured masterpiece by Michelangelo. Can a computer really do that? Maybe. Or can a computer really paint the Mona Lisa? Maybe. But there's some parts of that just you can't, the depth, the different things that are involved in certain parts are just missing. And so, we can, the problem, other thing about plastic surgery is the sort of the different things that are trends as it relates to, large buttocks, the trends related to large buttocks, the stigmata associated with those sort of things. Like, I think fads in plastic surgery are big lips, big butts. And they've done these studies before. You say, okay, well, look, let's look at a naked woman. And a man's looking at a naked woman. What do you think he looks at first? The face? The private area? No, neither one. And it's a well-known fact, he's looking at the waist-hip ratio.
Yes.
The ratio of the waist to the hip. First thing they draw their attention to, because that defines the silhouette of the body.
Right.
And the magic number is 0.7. So your eye is drawn to certain things, and these ladies are doing things that are crazy because they're not in tune to what is visual. And, when it comes to breast, I have patients, they come in with their significant other, I talk to them, they want their breasts bigger. All I'm doing is talking to the man. Excuse me.
Right.
The lady's having the surgery, not the man.
Right.
But the woman is being influenced by the man who's paying for it.
Right. Yes.
And the woman by themselves wouldn't do it if it wasn't for the influence of the man.
Yes.
These kind of things.
These are like a bit
it is
harsh.
What, it
yes.
is what it is.
Yes, it is what it is.
But you know,
in this modern life.
It's
you
modern
know.
life,
Yes.
and we talked about the different things
Yes.
earlier.
What about moles in the face and these things?
Okay.
Fillers, Botox.
Okay, let's talk about
Yes.
moles on the face, for example. Some people come in, they say, "Oh, I have this mole, but I like it. I don't want to remove it. It's my beauty mark." Well, it's a well-known fact that a mole that's in the center of the face can be pretty. Okay? Or it can be bad, one or the other. In general, moles that are on the outside, say lateral to the pupil, are not as really a bad thing because they're on the outside.
Right.
It's like big ears. You don't notice big ears in people.
Right.
You don't even notice big earlobes sometime in people because they're on the periphery. But in the center, you will notice them. So if they're in a strategic location and not too big, it's fine. But in general, the more toward the center of the face, the more you want to remove it.
Right.
Unless it's a cultural thing.
Okay.
Some Asians want to keep that mole because it's cultural.
Right.
There's some stigma associated with it. Same thing applies to tattoos, for example. Tattoos came from scarification back in the prehistoric times when the men were fighting and they had war injuries and they had scars. Well, scarification, it's a great thing. Men look tough with a big scar. And it's a well-known fact that they've done studies where tattoos in men are more acceptable and they can look okay. In women, a little bit different story. They're not as generally as accepted, even though a lot of people do them today for different reasons.
Right.
But in general, that's the case. As far as earlobes are concerned,
Does the ear age?
definitely the ear ages. Every part of the body ages, but it's a fallacy to think the ear gets bigger as you get older. What happens is the earlobe gets longer. Women wear long earrings. They wear heavy earrings. The earlobe gets longer and stretched as you get older. So when we do a facelift, sometimes I'll make a beautiful face and the earlobe's still long. I go, we need to reduce the earlobe or you're still going to look a little older.
Right.
It's like looking at looking at hands.
Wow.
You want to look at a woman's age? Look at their hands.
Yeah.
Or their décolleté.
Yeah. Are there plastic surgery for the hands to look younger?
Yes.
There are.
There are peels, there are fillers so you don't see the veins.
Yes.
Lots of different
Yes.
things.
So my last question for today, if there is something you want to create to advance plastic surgery or to maybe stop aging or help in keeping people young forever, what will it be?
I don't know the age
Technologically or as a procedure? And if there's something you want to...
I would love to envision a pill that you could
the
take
easiest.
that would increase telomeres,
Right.
that would prevent you from aging.
Right.
However, with that, we have to separate looking good from feeling good. Look, it's a well-known fact. The body is no more than a machine. I don't care what kind of machine you're dealing with. It can be a car. It can be a typewriter. It can be anything. It ages with time. The more movement it has, the more it's going to age. So what good is looking good if you don't feel good and the body parts are worn out? So the truth of the matter is, answer to your question, I'd love for there to be a pill or something you could take to reverse aging. But I think the key today is longevity in terms of function and some of the things that are out there today that are increasing people's lifespan and making them healthier at the same time.
Yes,
That's
great.
what I envision, which would be good. And AI can help with that.
Dr. John Shamoun, thank you very much for being with us today. If you want to say a final message to our audience.
Well, my final message is I enjoy being here in the GCC. I've enjoyed working here. I'm grateful for the good Lord giving me the ability to give back to the community. And I will just say that just do the right thing the right way with the right surgeon at the right time.
Right.
So I think those things are crucial in order to stay out of harm's way.
Right. Dr. John Shamoun, thank you very much for being with us today.
You're very welcome. I
Thank you.
appreciate it. Thank you.